Right, esteemed members, good evening, and thank you for joining us today. And just to confirm, if you can hear me, send us a message on the chat and let us know which PSK branch you're joining us from. All right, thank you, Dr. AJ. Dr. Mercy from Nairobi, welcome. Thank you for your confirmation. Thank you, Dr. Francis from Nairobi branch. Dr. Vincent from Nakuru, thank you. Dr. Josh from Mombasa, welcome. Amos from Kakamega, thank you, welcome. Just as we give a few minutes for our colleagues to join, I'd like to encourage you to visit the PPB portal and subscribe to this event. The keyword is digital disruption. Please take a minute of your time and subscribe to the event on the portal. Right, I think we'll get started. Once again, thank you for joining us today. This webinar has been organized by the conference organizing committee, and it's building up on some of the sessions that we'll be having during the conference that is focused on AI. And for this session, we have the topic on digital disruption in pharmacy, harnessing AI for better outcomes. And for this webinar, we have two of our very own pharmacists who will be speaking. That is Dr. Sylvia Mwelu, who will be later introduced by the moderator of this session, and also Dr. Johnson Anyona. Once again, I'd like to remind you, ensure that you subscribe to the event on the portal. This will enable us to send the CPD points on time. So at this point, I'd like to welcome our moderator today, who I'm going to just briefly introduce. His name is Stephen Osewe, and he's a seasoned health informatics specialist with 20 years experience driving digital transformation across Africa, Asia, and the Caribbean. He specializes in enterprise-level interventions that strengthen enterprise architecture, digital public infrastructure, and interoperability in the health sector. His work spans health management information systems, data warehouse and data lakes, as well as the design and deployment of artificial intelligence and machine learning models. Stephen is also a strong advocate for standard-based interoperability, including FHIR. I believe he's going to share what that is, and other global health standards, clean code architecture, championing the principles of digital development, and has supported numerous countries in adopting structured, standards-driven approaches to digital health. So at this point, I'd like to welcome Stephen, who's going to be the moderator for this session. Stephen, if you can hear me.
Yeah, I can hear you, everyone, and thank you for having me today. You can quickly move us to slide 6. Yeah, so as we welcome. Yeah, so thank you so much once again. So we are going to discuss a very interesting topic about disruptions, and I just want to look at how these disruptions are going to affect the pharmacy or the future pharmacy practice. And with me, I have two distinguished guest panelists. So the first panelist is Sylvia Mwelu. Sylvia Mwelu is a digital health technical lead with the Kenya Health Informatics Association, KEHA. Sylvia, you can just wave to them. I know they see you. Yeah, thanks. So Sylvia is a pharmacist and currently serving as a digital health technical lead for the Kenya Health Informatics Association, KEHA. And Sylvia, when your time comes, you can tell them how to join KEHA and what KEHA does in a nutshell. Yeah, so she leads the professionalizes the development and practice of health informatics in Kenya, and I believe across Africa, for continuous improvement and access to affordable and quality healthcare. So Sylvia's portfolio covers the entire continuum of health. Our next panelist is Johnson Anyona. Johnson Anyona is a pharmacist and a supply chain manager at InSupply Health. Of course, I'm sure he'll get a chance to tell us what InSupply is in brief. And with over a decade of experience advancing public health supply chain systems across sub-Saharan Africa, he holds a master's in health supply chain management and has led the development and use of digital innovation in quantification, big area, pipeline monitoring, performance management, and strategic resource. Johnson, you can wave again to them. Yeah, thank you so much. So we want to dive straight into the topic of the day and basically look at what are these disruptions. So we want to demystify what disruption is, especially digital disruptions. And we want to answer the question, is AI part of the digital disruptions? Is, what basically is this constituting digital disruption? And also what are some of the areas that are going to be affected? Yeah, so we're going to have a very interesting slide looking at what we're doing now and what they're going to be, how they're going to be done in the future. So you can move on to the next slide. Yeah, so disruption basically leads us to transformative impact of emerging digital technology. So how the emergence of technology is going to transform the pharmaceutical practice. There are certain technologies that we're already seeing that are leading this transformation, and these are things like artificial intelligence. And artificial intelligence is a broader aspect, is the broader practice of using machines to learn. And the first artificial intelligence model were done in 1958. So you can imagine how far behind this technology started and where we are now. So of course, a lot of technological resources were missing then, which are available now. Then we have the e-prescriptions. How is this changing? We are used to people going. Now we can do this online. Telepharmacy, mobile apps. So the main objective of all these transformative technologies is to redefine, is to transform how the pharmacy service is being handled, from the delivery to access and the overall management of the pharmaceutical practice. Next. Yeah, so I believe majority of the members in this group are familiar with this slide, and especially the practice, the middle column where we have the practice itself. So we look at prescription handling. How is this being done? Paper-based, in person. What others are already doing, or what others will be doing in future, is moving into e-prescription remote verification. So using technology to make these things done. So physical presence is not required. So what changes in terms of dispensing? We are doing it manual, it's pharmacy-led. We are moving into automated dispensing, robotics, machine learning, and generative AI, ChatGPT, DeepSeek, all coming into that space. Patient counseling, when you're giving the drugs to the patient, you tell them how they need to take, or, what they would expect, or maybe just have a chat with them. Right now, in pharmacy visits, but others who have adopted technology are using chatbots to advise the patient, virtual consultations to, give the same counseling to the patient. In terms of the inventory management, one of the biggest headaches I know is stock taking. Trying to find, you don't want to run out of stock, you want to move out the first expiry, so every end of week, end of month, end of quarter, you have to take stock so that you're sure of what you have. Very soon, AI is going to do that for you. Take stock, forecast, and even tell you how to introduce a certain drug into the market, the kind of quantity you need to bring into the market so that you don't run at a loss. And I'll remember to share that of a practical example we did in Ivory Coast, where we were introducing a family planning drug into the market, and we were using a model to tell us how much we should introduce into the market based on certain aspects or based on the experience of other drugs that were given introduced into that market. In terms of DRS monitoring, patient reported, then we're using the smart pill bottles are coming up, the mobile apps are coming up. Data recording, we have physical records, and now we have EHRs. I'm sure many, even public facilities, have EMR, EHRs, and the entire continuum of care is now, consolidated within a system that now allows people to use digital tools rather than paper tools as before. So those are the two slides that prepare to just set the ground and lead us to this discussion. And the first question that you want to address, and this goes to Johnson, is with all these in your practice within InSupply or in your practice within AI, what have you seen as the digital disruption? And confining yourself in the context of pharmacy practice today, what are these digital disruptions?
Great. Thanks so much, Steve, and greetings, colleagues. It's an honor to be a panelist in this session. So to your question, when you think about disruption, for me, it's about making significant shifts to how things have been done. So you're sort of rewriting the rules of an entire industry. You're not just making small enhancements, but you're sort of forcing an entire sector to adapt, to evolve, or even some other technologies to collapse. If we look at some examples, general, not before even we dive into pharmacy specific, we've seen this play out in Kenya and even globally. Those of you who happen to have gone to high school before 2005, if you remember how you are receiving money, pocket money from your parents, I'm sure you can remember that period. It was a very difficult time of accessing funds. So maybe somebody had to use money order or driver to Atumwe to drop the money physically. But after 2007, M-Pesa came and completely transformed how we transact, bypassing the traditional banking sector. Yeah, you remember we used to queue in lines to pay just electricity bills, but now you can do all that at the click of your phone. So we have other examples, Uber, we have Airbnb, Amazon, and you can feel free to share more examples of some disruptors globally in the chat. But now when we come to the pharmacy sector, disruption is about technology-driven shifts that are making, altering how either we are delivering, how we are accessing, or how we are consuming pharmaceutical services. So it's not just a matter of digitizing things like stock cards. No, you're making those drastic shifts to the pharmaceutical sector. Some examples that I've interacted with, encountered, are things like MyDawa. I'm sure most of you have heard of MyDawa, how they've been able to revolutionize pharmacy from the traditional brick and mortar to the e-pharmacy platform, where you don't need to physically go to a pharmacy to get over-the-counter or prescription medication. We have digital counseling services nowadays which are available. Platforms like Nivi, if some of you have heard of Ask Nivi, these chatbots that offer digital safe spaces for counseling. We've actually partnered with them as InSupply when we were rolling out family planning services through the pharmacy sector, where clients who are accessing self-care were able to get counseling on their mobile phone, not having to physically interact with the pharmacy or a clinician, so to speak. So when you think of disruption, just think of something that is transforming radically how things are done in a given sector. Back to you, Steve.
Yeah. Thank you so much. I think a good example to just back up what you're saying, when the hailing taxis started, our local taxis were really reluctant into adopting the disruption. So they tried to fight it, and eventually now, if you're coming from the airport, you realize one taxi guy has like all the apps. So that basically means you have to go with the flow. You have to take advantage of the disruption. So, but basically, disruption has to have guardrails, and I think our government of Kenya understands this, and we have some measures, or we have some guardrails that have been put in place in terms of policy, in terms of papers, in terms of bills. Maybe Sylvia, how has the government responded to this? Because I do believe that any disruption has to be not to be controlled to inhibit innovation, but to be controlled to be meaningful and to be responsive.
Thanks, Stephen. Hi, everyone. All over 400 of you. Very nice to have you join us today. So just a disclaimer before I start. I do not work for the government, but we have worked closely with them in supporting the development of policies and frameworks and guidelines around digital health. And I think you may be aware of something known as the Kenya Digital Health Superhighway, which was a huge topic of conversation last year and towards the end of 2023, that led to the development of the Digital Health Act, which I hope all, if not most of us, have read. I think it's very important for us to be aware of these policies that are being developed around digital health. And I think the government has acknowledged the need of ensuring that we have an enabling environment for this vision for digitization we have for the health sector. And an enabling environment means that we have the correct governance structures, we have the correct regulations, we have the correct standards, compliance, conformance systems in place, so that if we are building this national health management information system, we have a structure that ensures that the data that is collected is within confines of the law, that we have structures in place, that we have systems in place. So I think, and I think most of you may be aware that Kenya is one of the more progressive countries in this sector, because we have a formal law for digital health specifically. So this has been applauded worldwide as very progressive, and other countries have actually borrowed the Digital Health Bill, Digital Health Act, and made reference to it when they are developing their own digital health frameworks. So I think it's important that we have this basic structure that enables any level of transformation and disruption to happen. So we have the Digital Health Act, which is our basis for everything. And I think we also have the Data Protection Act, which was passed in 2019, which is not health specific, but it provides legal boundaries for how data is managed on a national level. And something that the Ministry of Health tried its best to do was to make sure that the Office of the Data Protection Commissioner was involved in the development of the Digital Health Act, So it was a very consultative process, as all governance processes should be, because it's a stakeholder. It involves many people in the ecosystem. So it's important that multiple stakeholders, private sector, public sector, development sector, are involved in these conversations, because these policies will affect everyone. So those are some of the things that have been developed. And of course, as a result of those things, there's recommendations from the Digital Health Act, for example, that we will have a digital health agency that's responsible for operationalizing this national health information system. So if you read the act, you will see the responsibilities and the governance of the Digital Health Agency. I won't get into that, but they really will have the mandate to ensure that we are actioning this vision in the right way. And also some of the recommendations are that we will have a data governance framework, which just provides the setup of how data will be collected, stored, managed, deleted, exchanged across borders, and also the consent that needs to be sought for patients as their data is being collected. So I'm not sure if this is live yet, but it's something that the government has really thought about expansively. And I think it's very important as we're having these conversations, because that, as I said, provides the enabling environment for all of this to happen. Yeah, back to you, Steven.
Thank you so much, Sylvia, and thank you for that policy angle and the infrastructure. I want us to delve a little bit more on the infrastructure. What out of the policies or out of the the moves that the government is making, what are some of the outcome infrastructure? So we maybe highlight a little bit on the superhighway and how that is going to spur this disruption and enable more data to be available for people to do research, for people to build models. And immediately after that, I'll come to you, Johnson, and you tell us what are some of the practicals, practical AI that you're involved in right now, basically maybe in the country. So we move to Sylvia about the infrastructure, and then quickly jump on to examples that Johnson you're currently doing.
Okay, thanks, Stephen. So we have this vision that we are calling the Kenya Digital Health Superhighway, which was a kind of simplified, easy to pronounce definition of what a national integrated health information system is. So this is basically a structure or a setup that ensures that all the systems within the country are integrated or interlinked, that they're able to communicate, that they're able to exchange data, that they have a uniform structure, a unified structure to ensure that everything that is collected can be exchanged and can be rationally used to make decisions. So I cannot get into the full details of it because I will probably need another hour, but just to give a very surface level explanation is that we will have the core digital health services, such as a client registry where all the clients in all the patients' data will be hosted. We'll have a community unit health registry. We'll have a health worker registry, and this will be done in collaboration with, for example, Pharmacy and Poisons Board, KMPDC, the Nursing Council, to make sure that all health workers in Kenya are registered and all the information is hosted within a registry. And then we'll have a national health terminology service, which I think is very relevant for us as pharmacists, because all the drugs that are in the country need to have a code, one code. So that if information is shared across systems, if a pharmacy is in Bungoma, for example, KEMSA is in Nairobi or wherever, and we have another hospital in Nairobi, that all these systems in these different places can be able to exchange data, and the systems can understand what this data means. So whatever we call paracetamol in one area is the same thing we should call paracetamol in another area. Whatever we call malaria in one area is the same thing we call malaria in another area. So that's basically what a terminology service is. I will come back to your question, Suraj, in a second. And then we have a health facility registry, which we already have this. It's called the Master Facility List. I will share a link on the chat. It was launched in, I think, 2023, which is a record of all the health facilities in the country. And then we'll have the National Health Shared Records. And then we will have claims management system, and then all telemedicine services also have to be linked with the digital health superhighway, and then the logistics and supply chain management systems have to be linked. So that's just the core of it, and then all point of care services, all HE systems, all other government agencies and partners such as PPB, KEMSA, KMPDC, all of these things have to be linked in the system. And all this has to have the foundation. As Rimbai said, the enabling environment of governance and regulatory structures, so that we are not just haphazardly linking our systems that are not interoperable. And I think if we are on the topic of AI, I think some systems were developed without having AI in mind. So how do we make sure that we are, can I say, transforming our systems, adopting systems that can be linked and integrated into this superhighway? So it's just making sure that we have the governance in place, we have the right infrastructure, that we have electricity in our hospitals, we have the correct equipment, we have data centers to host our data, because most data that we collect here, unfortunately, is not hosted here. So how do we make sure that the data we collect stays here and is used for our benefit? And then patients will also have access to their data through USSD portals or a web app or SMSs. And then all of this has to be linked to a national analytics system, for example, so that in case there's any outbreak or there's any surveillance that needs to be done, we are rationally doing it within this health information exchange. So that's just a basic overview of what it's going to look like. And there's a huge, massive push to have this rolled out. And I believe in it 100%. I feel like it will revolutionize how health operates in Kenya, because everything is so fragmented and we do our own thing, and we don't have structures in how we think about health and digitization in health. So I think the HIE model is very important for us to really have structures in how we think about how to organize the data that is collected within the country and how we can link all our systems so that they can be able to communicate with each other. Yeah, thanks.
Yes,
I don't know
thank
if
you.
we
Thank
should
you so.
answer questions now, or can we, in case they get lost, maybe Hez, you could help us take note of the questions and then we can come back to them at the end.
Yeah, yes, perfect. And just asking the participants not to get lost. We are carefully navigating between the infrastructure, the policies, and what is going on. So I want to bring in Johnson to quickly highlight for us the real disruptions. What are you working on? What kind of models have you built? What kind of problems have you been able to solve? Yeah.
Thanks. So I mentioned at the beginning that I work for InSupply Health. So for those of you hearing about InSupply Health for the first time, we are an East African health advisory firm, pioneering approaches for improved health access and outcomes in the area of health system strengthening and supply chain. So one of the areas that we are actively applying AI in is in forecasting. Forecasting, in simple terms, is what you typically do in your household before you go to shop. Basically, you are saying, I need A, B, C, and D in these quantities so that it can last me for this period of time. So now, in the context of health products and technologies, we've applied AI in the forecasting of health products and technologies that are procured by the county, as well as those in the vertical or national programs, particularly family planning and MNCH. So I'm going to use family planning program as an example, as one of our most advanced use case of AI practically. So traditionally, forecasting relied on manual Excel systems. If any of you has ever taken part in a quantification exercise, you know exactly what I'm talking about. Typically, it takes about 5 days or a 1-week workshop. And in those 5 days, almost 3.5 of those days is just manually extracting the data, cleaning the data, and then generating forecast. So this is time consuming, And then there's, of course, margins of error are great, so your focus will likely be inaccurate. So we've been able to leverage machine learning. So that is like the language that is used to develop AI, so that we can be able to automate and strengthen this process. So we've utilized algorithms, just to mention a few, Prophet, XGBoost, ARIMA. So we use, or we mine the consumption and service delivery data from our health information system. In the case of family planning program, we go as far back as 2021 to date, so that we are able to detect any patterns, things like seasonality, correct for any anomalies, so that we can generate more precise data-driven forecasts. So the models that we've applied, we've noticed that they've significantly outperformed the manual forecasts that we used to use in the past. And one of the indicators that in quantification that we usually look at to assess how good or bad your forecasts are is called forecast accuracy. So forecast accuracy simply tells you how close or far off were you to the real life demand. So if you look at the forecast accuracy of a product like EPO, or the injectable intramuscular contraceptives, we noticed significant decrease in the margin of error to about 6.5% compared to 26% for the manually generated forecasts. So we started initially with two commodities, but now in the most recent quantification exercise, which we conducted just recently in November of 2024, the Ministry of Health, in partnership with ourselves, were able to adopt 8 out of the 13 FP products being AI-generated forecasts. So that's a big plus for how the ministry is also getting the buy-in to shift to more advanced methodologies and applying AI to enhance this process. So at the moment, there's a lot of growing interest for the ministry to expand the use of AI to other programs. So MNCH program are also keen on making use of this. So we've been able to train the county and the national teams to interpret and make use of these AI-generated forecasts. So this has particularly been critical to promote ownership and also sustainability. So our focus isn't just on the technology, but building trust. As we learned from the examples shared earlier, people are usually skeptical at the beginning when there's something new that's coming up, trying to cause this disruption. So that building that trust and the capacity is really instrumental if you want to adopt the behavior change for people to uptake this. So Steve, maybe if we get some time towards the end, I can do a quick demo to just show guys the platform that we've developed for the forecasting that we are using for family planning. But I'll pause there for now and back to you, Steve.
All right, sure. So talking about disruptions, talking about AI, it's currently rather not possible to talk about AI and miss the debate on bias, right? And probably I would really like to know the biases that you've encountered and what has led to those biases, because every time you talk about AI, bias has to be there. You've heard of the models that were biased against Black, and you see the biases are created by the people who build the models. But before that, Johnson and Sylvia, just for our audience, looking at the entire pharmacy workflow, where do you think some of the possible areas that AI could plug in, looking at dispensing, looking at inventory, looking at, the clinical decision support and adverse reaction? What are some of these areas where you think AI could plug in even as we move with this disruption?
All right, so I can go first. So whenever you hear a big opportunity, it means there's a big challenge. So with every big opportunity, there's a big challenge. So if you look across the public and private sector, the pharmacy, the health space, what I would say are the most persistent challenges are issues to do with stockouts, expiries, and overstocking in some instances. So those, I think, are the areas where AI can now have immediate high impact applications or opportunities. So one of the big opportunities, I think, lies in demand forecasting, which I've talked about the work we've done in the public sector. But even in the private sector, there's a lot of data that already exists in our point of sales, in the routine logistic systems that is just waiting to be harnessed. Yeah? So AI can be able to analyze those seasonality trends, how your historical consumption looks like, what the disease burden is, even in your pharmacy. Maybe there's a certain disease burden that is higher than others, so that it can help you more accurately predict your stock requirements, and also help you reduce wastages from overstocking, which of course is loss of money. The other opportunity now, touching on the public sector, in many of the public health facilities, inventory tracking or inventory recording is still done manually. I know there's plans to roll out this Taifa Care that hopefully will be able to digitize our inventory systems, but presently that is what is in practice. People are using handwritten bin cards to capture their stocks. So I think there's an opportunity there for AI to use optical character recognition, for example, to extract this data, because the data collection bit now is the challenge. If from my own example, when we were doing the county quantification, we had to manually visit facilities, collect data from stock cards. And if you can imagine a large volume facility like Mbagathi or
And
Mamalusi or
that introduces the problem of data quality again.
yes, or Nakuru PGH or Kakamega CGH, those big facilities. Going through, let's say, a stock card for paracetamol and getting data for 6 months is a very hectic and tedious. So optical character recognition, I think, is an opportunity for AI to be able to extract this data from the stock cards.
Yeah, thank you. I think our time is moving quite fast. Sylvia, maybe I don't know if you can talk about a little bit about ethics and biases. I don't know whether you have an example of this or something you can share.
Maybe not one specific example, but I think this is something we have seen or we have had stories about when it comes to biases with data, because even the tools we use now, like ChatGPT or Claude or Gemini, I think there's been stories in the press where there's biases that these tools have, and all of this always comes back to what data is used to train these models, because they don't just come up with things out of the blue. So it all has to start with the kind of data that is fed into these models, all the data that trains these models, because the biases will be informed by the data. And I think that's where Africa in general, we will see these biases for a long time, because we're not very good at collecting our data. And if we collect it, as you said, Stephen, the quality of the data we collect is very poor. So if we do not have data, and these models are trained by vast, massive amounts of unstructured data in very different modes, and we really don't have that. So there will always be a gap between the world and how it moves and how Africa moves, because we really do not collect data in the right format and we do not store it. So I think we always need to come back to, even when we think about the biases, we cannot blame these companies because we just do not have the data to train these models. And I think when we collect our data and we are training and we're using our data to train whatever models we want to develop, I think it's important that our data represents our diverse population, because we are a country that has however many languages, however many people. So the data we collect should be representative of all the people we have in our country, because that helps address these biases that these tools usually have. And I think it's important to also audit the AI systems as we develop them. So we should have auditing processes, so that people have, can I say, countermeasures, that if a model is being developed, can we have someone counter checking and auditing these systems to ensure that we are correcting them as we develop them. And I think that's also an opportunity for us as pharmacists, because we have the health background, we have the health knowledge. So how can we complement these tools, and how can we work in collaboration with these tools to ensure that we are verifying the outputs of these tools that we are developing? Yeah.
Yeah, thank you so much. So as we wind down our time for this discussion, like I said, interesting topic. It can go on and on. So one more question though for you, Johnson, even as we go back to give our final comments. I know maybe I'm a pharmacist sitting here, I have data, I have tools, and I'm wondering, I have no training in statistics, I have no training in computer science. What kind of disciplines do I need to work with to achieve, a functional AI model? Or maybe what kind of ecosystem of discipline do I need to support me to do my model, Yeah.
Thanks, Steve. Yeah, so if just reflecting back to the slide that you had shared earlier, showing where the future is going from the traditional to now how AI is causing these disruptions. I think it's inevitable. And it's time for pharmacists to really embrace some of these technology skills to stay relevant and to lead in the evolving healthcare landscape. So many of the things that we've traditionally done, if you remember, even from the era of when people are using logbooks to do mathematics and then calculators came, if you remember, some teachers were really resisting. So you just have to embrace some of these technical skills so that you stay relevant to the changing tides. So practically, from what I've seen at InSupply, even reflecting on how we were able to build our forecasting AI tool, of course, you definitely need data literacy. Yeah, that's like the bare minimum. So you need somebody in your team who has the data analytics, data literacy skills. So Excel, Power BI, and AI is critical, those skills. I think Sylvia touched on some of those health informatics platforms. So understanding the electronic medical records, whatever platforms will be there, from the Taifa Care that is coming, KHIS, the LMIS. So you need to understand where this data is coming from that you're going to use to mine and train your models on. Then I think you also need skills on cybersecurity, on data governance, issues to do with ethical use of the AI data that you'll be handling. Machine learning. There's also an element of human-centered design. Remember, at the end of it all, you're designing for a client. Most of the time, this client is either the pharmacist in the retail pharmacy or the end user, the client. So you have to understand and make sure that whatever innovation or whatever tool you are creating is aligned with the needs of the users. Then most importantly, you need domain expertise. So like in our case, we were building a model for forecasting. So you definitely need people in your team who are gurus or who are skilled in quantification. They'll give you the context. They will tell you what they want their tool to be able to do and what problem they would like to see your tool solve. So like in our case, there were issues on data cleaning, detecting anomalies, automating or making the process more efficient, generating accurate forecasts. So that domain expertise, I think, is also a critical discipline to have in the team as you're assembling a team to develop an AI model. Back to you, Steve.
Yeah, thank you so much. I was worried you're going to forget yourself, the domain expert. So the good news is, as a pharmacist, you're the domain expert. Like, so you're inside the equation, you're not outside the equation. So you should be getting some claps for that. Yeah. So as we wind down, we just want to bring in Sylvia to give our final comments, maybe 1 minute each, and then we should be handing it over back to Hesbon.
Okay, thanks, Stephen. I think my one comment would be it's very important for us to be involved in these conversations when it comes to especially the policy side, because that's where I've spent most of my time. I think it's very important for us to be a part of these conversations. Anytime there's a forum, anytime there's conversations or discussions happening about the future of digital health, it's important that we are in these rooms and we are contributing to these processes, because that's the only way we will not be left behind. I think that will be. Oh, and my other parting shot will be: please read the law. It's very important that we are aware of the laws and what they mean. I know Kenya is not a very litigious society, but I think it's very important that we are aware of what is happening, what is the legal boundaries of what is happening, because there's going to be so much change and evolution, and we really want to make sure that everything we are doing is within the law, because people are getting sued a lot, and it's important that we are aware of this as we are developing our systems. Yeah, thanks.
Thank you. Johnson?
Yeah, so for me, I think is just to rally my colleagues. AI is the next big thing. If you've not had that before, I think, yeah, there was the era of the computer that came from 2000s. There was the era of the mobile phone. This is now the era of AI. So it offers us immense possibilities from smarter forecasting, smarter inventory management, better efficiency. There's immense possibilities. So I urge us to embrace this shift intentionally, build our capacity, but also keep in mind the patient. Yeah. So that ethical aspect of the data that we are using, we need to use it responsibly, so that we can be able to lead and be at the driving seat of this innovation and not just be passers by. So the opportunity is there. Please take advantage of it. And hopefully, Hez, you'll be sharing some resources for guys to refer to, so that if you are interested, you can upskill yourself. If you're interested to learn on the legal, the policy framework governing AI, please take advantage of this opportunity. Catch the wave. Let not the wave ride over you. Thank you.
Yeah, thank you so much. So I think for me, my parting shot is very simple. A lot has changed, and systems and technology has changed. It's simpler now to build a small system, connect to another big system. You don't have to eat the entire cow. You do the tail, someone does the leg, someone does the neck, and people are building a society where systems are speaking, and that's where standards are coming in, and the government is setting up infrastructure for that. And I think one other thing, not to burst your bubble, is you can't talk about AI, machine learning, and with all these new disruptions without talking about data quality. So data quality should be your first check. The same way when you have a check engine, you check at your oil, data quality should be your first check. If your data is not of good quality, your models will be wrong. Your model will mislead you. Your model will take you around in circles and you will not get the results that you want. So once again, thank you so much to the organizers. I know we've spent 5 minutes or so on top of it, but as I said, this topic is usually interesting, and we can spend all the time here. So let me hand it back to Hezron for the follow-up programs. Thank you so much, and enjoy your evening.
All right. Thank you so much, Stephen. And Dr. Johnson, Dr. Sylvia, thank you so much for that exciting discussion on AI. I think before we jump into the questions, we'll first have the Kahoot. Meanwhile, I'd just like to encourage all of you, if you have any questions, put them on the Q&A tab, and our panelists will be able to respond to them immediately after the Kahoot. So at this point, I'd like to welcome our facilitator for that session, Sami Atia from Cosmos. Karibu.
Asante sana, Hezron. Thank you for this opportunity. Thank you also for all the other speakers and panelists for the wonderful discussion. So I'm just going to take you through the Kahoot. I have 3 Kahoots, so maybe Hezron will guide me on whether to do them all or just one. So I'm sharing my screen. I hope you can all see my screen.
Yes, we can see. And I'm thinking we could maybe have 2 so that we can have the Q&A.
Okay, so this is the first one. Let me just host live. Kindly go to your browser and load kahoot.it. Kahoot.it. Then have this game pin 3662805. 3662805. You can use your registration number, PPB registration number, as your nickname. Kindly note, top 3 will be awarded. Top 3 will be awarded. We are at 52. 1 more minute. 1 more minute, then we start. I think we can start now because of time. So this is the first Kahoot. 2 pills and a truth. So you are supposed to spot the truth. Spot the truth. Number 1, which platform and partners are running this game? Which platform and partners are running this game? Speed matters. Speed matters. Good. Hata baada ya Mwakenya. Okay, good. Number 2, in Kenyan rugby, Kenya has qualified for the Rugby World Cup. The Simbas is the name of the national team. Current captain of Kenya rugby team is Humphrey Kayange. None of the above. Spot the truth. Spot the truth. Good. Tumepatikana. 2790, I can see you. Number 3, for PSK membership, PSK fellows are full members. Associate members must be below 35 years. Pharmacy interns are full members of PSK, none of the above. Speed matters, guys. Speed matters. Good. 2790. Okay. The PSK ASC 2025 meet and greet is on Tuesday, 6 p.m. at Chachoma, Wednesday, 6 p.m. at the beachfront, Sarova White Sands, on Friday from 6 p.m. at Travelers Warsons, none of the above. Good. Stress. The conference website has all the conference partners' logos on display, has all the poster presentations on display, has all conference guidelines and terms of conditions on display, none of the above. Spot the truth. Good. Tumepatikana. 27, 28. Last question, which statement about PSK is true? PSK is a registered professional association, registered professional society, or a registered professional union, and none of the above. Good. So let's see. Number 3, 27, 28. Number 2, 5209. Number 1, 2785. Congratulations. So the top 3 will be awarded. So allow me to start the second one. Is that okay, Ezron?
Yes, we can finish with that. Yes.
Okay, good, thank you. So let me host live again. So Kahoot.it. This is the game pin 416-6477. 416-6477. Good. So we can start. Now, spot the pill. Spot the pill. Which matatu sacco in Mombasa gets you to Sarova White Sands? Is it Kisauni, Likoni, Mombasa, Madafu Sacco? Madafu Sacco is the odd one out. 4940, can see you. Number 2, the following are PSK subsectors: WOPAC, HOPAC, COPAC, none of the above. WOPAC. Okay. 2790. Number 3, which has been the official communication channel for the conference? LinkedIn, phone calls, email? None of the above. Good. Tumepatikana. Rails. These teams have over 10 EPL wins. These teams have over 10 EPL wins. Football lovers. Over 10 EPL wins. Chelsea. JA. Second last question. The PSK conference has been done in partnership with international organizations before, has always been in June, has been done at the cost for the past few years, none of the above. Has always been in June, yes. JA. Last question, cheapest route to Mombasa is by? Cheapest route to Mombasa is by? Yes. Good. So let's see. 2790 number 3. 4940 number 2. Number 1 is JA. Congratulations. So remember the top 3 will be awarded. So we have 6 participants that will be awarded. I will organize together with my colleagues and Hezron as well on how you'll get your prizes. Thank you so much. And back to you, Hezron.
All right. Thank you so much, Sami, for running that session. And congratulations to all those who've won. And also for the previous sessions that you've had. I think some of these gifts that we've won will be picked at the PSK conference or at the PSK offices. So you can contact us on how to receive them. So we'll move on to the Q&A now. And we have a couple of questions that we received for our panelists today. And the first one is from Dr. Sorej, who's asking, will private hospitals also participate in this superhighway? So I think maybe, I don't know if that's a question to Dr. Sylvia.
Yes, I can answer that. So yes, everyone in the country, so public, private, development, third sector, faith-based, everyone will need to be onboarded to the HIE, the superhighway, once it is fully operationalized. So the vision is that all the systems, and I think I've put some insight on this on the chat as well, is that all the systems that exist within the country have to go through a certification process where which basically means that your tool, your product, your system will be assessed. The compatibility within the HIE will have to be assessed. So there'll be a checklist, that a criteria that has been set that you need to meet so that you can be linked within the HIE. So that is the plan, and every system in the country has to go through this process. The certification framework has been developed. I'm not sure if it's live yet, but if you read the Digital Health Act, it's also mentioned. And so the thing that the ministry is doing to make sure that it's easy for everyone, and I think, Hezron, you mentioned it when you were introducing Stephen, is that there's this thing called FHIR guidelines, which is an interoperability standard that is used by many tools, specifically open source tools. So This guideline is what is recommended as an interoperability standard for the health information exchange. So instead of having everyone develop their own FHIR implementation guide for their systems, the ministry is trying to collaborate with partners in the ecosystem to develop FHIR implementation guides that will be adopted by everyone, just to simplify the process. So these are some of the things that we are thinking through together with them, so that if we know we want to develop this HIE, what will we need to think about to make it easier for everyone to integrate in the end? So I think in summary, that will be my response for that question. I'm happy to chat with anyone about it and give my insight. Again, I don't work for the ministry. I just support these processes and I'm an outsider, so I'll only be able to give an outsider's view. But yeah, happy to chat with anyone about this.
Yeah, so maybe as we close, Sylvia, in our physical panel in Mombasa, we're going to have Dr. Wesley, who I think will have full authority to speak on behalf of the government because he is involved in that. But I think the dream is much bigger, and the dream will even go beyond cross-border data sharing. And I think this is the reason why we are focusing on standards. So when we're building on standards, it means that systems can communicate easily, systems can speak the same language. It's easier to share data across TZ, across Uganda, and then there's also a huge effort within Africa to ensure that data can be shared across Africa. So I think we can have more of that discussion while in Mombasa as well. Thanks.
For that, there's another question here, or it's more of a comment for the AI-generated forecasts. Are these within the government systems? Since this is critical for sustainability, acknowledging the ripple effect of the recent stop work order that affected the donor-supported data systems. So I don't know if this is something that you can respond, Dr. Johnson.
Yeah. Yes, thanks for that question. Yeah, so we have that in mind, and at InSupply we normally say that we start with scale and sustainability from the word go whenever we are coming up with a new intervention or new innovation. As a matter of fact, just last month we had an engagement with the ministry and stakeholders to sort of standardize the process and have a roadmap towards transitioning and hosting these tools to the MOH. Even the MOH ICT was in that session, and we have now a clear pathway on how ultimately the tools, not just this one that I was talking about, but all the suite of tools that we've developed for forecasting, for the county quantification, for the national quantification, and some other innovations that we are working along with to aid the whole process. Long-term, or rather medium-term plan is to have them hosted on the MOH platforms. Thank you.
Right, thanks for that. And I see there's a comment from Dr. Vincent who says AI output accuracy depends on the prompts and the data that is fed. And also Mark says AI is able to detect outliers and clean the data. So there's another member who's saying, I've always wanted to create a software that can help us do away with paperwork. For example, instead of using papers in files which tear and get lost, if we had a software which the entire nation would adopt, it would save us resources and energy. Maybe I'll just give an opportunity for any comments that are there with regards to the feedback that you've gotten, with regards to the prompts, depending on the data that is fed. Do you have any comments from the panel on that?
Yeah, maybe just to quickly run and talk about these. And one of the biggest challenge that the AI models are facing. So one is data quality. So the data, so there are models that are agnostic to data noise. So basically, if your data is not clean, there are models that will struggle, or algorithms that will struggle to learn and detect pattern in your data. But it's an area that is being developed. So basically, the lowest threshold is to ensure that your data is of high quality. So considering that the models are learning continuously, so it's a continuous learning kind of, and as you put in more data, the model learns better and the algorithms are able to detect more patterns and therefore be more helpful, then that means that you must have a huge volume of data. And that's the other thing Sylvia hinted about. And this is the reason why we have these superhighway and the government trying to have the data into one place. So even in terms of research, it's easy, you can have access to more data. So data quality, volume, and then the bias. So the prompts, so we are talking about Gen AI. So if you've interacted with ChatGPT, you've interacted with Gemini, you've interacted with DeepSeek, then, we can ask the same questions in a different way and we get different results. So those will be the prompts. But if it's a model that is specific for a certain kind of, space, like what Johnson was talking about, quantification, then the prompts are curtailed to the concept or to the learning that the model has done. And this model do self-learning. So they are separate from the Gen AI. So the generative AI are like, ChatGPT, but there are models that you generate for specific topics. So they learn, you train them and then they self-learn over time. So as more data comes in, they get knowledge. And this is why they're saying that in the future, they get smarter than us because their threshold of learning is way higher than the human being's threshold of learning. So you supply it with more data, it gains more knowledge, gleans more knowledge, and can give you more feedback without even prompts. Yeah. Thank you.
All right, thank you for that. There's a question to Sylvia from Dr. Kinyua, who says the US implemented meaning use criteria for EHR, hoping to improve quality and lower healthcare costs. So far, research on effectiveness is mixed, with the EHR associated with the better documentation, reduced medication errors, following guidelines, but no effect on reducing mortality and no decrease in healthcare costs. Where would we expect better results in Kenya with less tech literacy and internet connectivity?
Thanks, Hezron. Very good question that I might not have all the answers to. But I think all I can say is that it's definitely process and it's a long process. We are just in the early days of thinking through what digitization could look like. And with that, and with us having this vision, which started back in 2016 when the process for developing a digital health bill, which was at that time called the e-health bill and has evolved all the way to digital health. The thinking helps us ignite certain things to happen. So we are thinking about infrastructure and how we can make sure that all facilities have the correct infrastructure. We are thinking about how can we start working more closely with partners, with private sector, so that we're not just driving this vision alone. The ministry is not driving this vision alone, that the partners are not driving this vision alone. So it's a long process. And I think it needs to be an iterative process that as we go on, we learn and adapt. And I think that's the only way we can, manage certain challenges that we encounter along the way. So this is why I think we would call on everyone. If we're having certain conversations, please come and be a part of them. Give us your perspective. If you're developing systems and you've encountered challenges, I think it's important that all of us are putting our voice in this so that if we encounter challenges as we grow, because we are very young, we are still a very quote unquote immature country when it comes to digitization. So we need all hands on deck. And I think that's the only way we can kind of get ahead of certain problems. And, the US system has its own challenges, which, we might not be aware of. But I think we are headed in the right direction and we have lit the right fires to make sure that we are building correctly. Yeah. I don't know if anyone else has anything to add.
Yeah, maybe I just jump in a little bit on the maturity of systems. Like any other system, each system has a defined continuum of maturity. So minimum, we normally say that for a system to be stable, you're talking about 5 years. And these you can relate with the operating systems that you normally use, like Windows XP, Windows, whatever it is now. You see there are regular updates that are being provided. So like any other system, it will take a while for the platforms or for the infrastructure to mature up. Of course, there are good things that are working on our side, like, the internet is available and the bandwidth is okay. We have, cloud services that are available that can, manage the high volume of data. We have a mature human resource in terms of technology within the country, but every system has to follow that continuum of maturity so that they are able to perform at their best. So the vision is there, like Sylvia said, like if you look at EMR, for instance, EMR has been in the country for many years. So we know like the Taifa Care or the Kenya EMR has been there for quite a long time, more or less matured right now, and new ones are coming into the ecosystem. So basically, as you set the standards, so the systems that were not built on standards may opt to build newer systems that are based on standards, or may opt to share their data based on that standard. So it will take a while, but like Sylvia says, the best fires have been lit and the base has been set. And like any other infrastructure, setting up the base and allowing the ecosystem to thrive will lead to faster maturity and operationalization of the infrastructure. Yeah.
All right, thanks for that. And I think we'll have the last question, which I see is addressed to Dr. Johnson and Osewe. The tools for better forecasting.
Yes,
Exponential smoothing.
I can take that.
Okay.
Yeah, so the question is regarding the capabilities of AI, and the fact that there are existing tools and Excel. Yeah, so I've been doing quantification for quite a while in my career as a supply chain expert and a pharmacist. And the most sophisticated tool that is out there currently, global good, I would say, is called QAT or CAT. And I agree, CAT does all those models that you've talked about, exponential smoothing, ARIMA, moving averages, etc. So that is the forecasting bit. So what I would say are opportunities for AI to enhance this. So first of all, if you're using CAT, you have to do the extraction of the data separately from wherever platform you're getting. In our case, that is KHIS. So our tool automatically pulls that data for you. So it saves that time that was traditionally spent in extracting the data from all. When you're doing a national exercise, you now have to get data from all the counties in the country, get consumption data, get service data, clean it before you use it for forecasting. So there's efficiency in that process that the AI brings in this case. There is the aspect of anomaly detection, and how I wish I could just quickly so that you can visually see what I'm referring to. So this is what the tool looks like. I hope my screen can be seen.
Yes.
Can you see the graph that I'm showing right now?
Yes.
So you can see, for example, it gives you a trend, it gives you historical data. You are able to pick whether you're using service or consumption. And I mentioned earlier that it goes back. The more data you have, the better data that is available to train and predict the demand more accurately. And if most of you remember, there was a downtime on KHIS about a month or so ago. So it is able to pick those anomalies. You can see this is an anomaly that is picked, all these red spots. So AI is able to quickly tell you, hey, we don't think this will be good data point for you to use. And it gives you the option of omitting where there are anomalies in the data for whatever reason. Then I mentioned that it automatically pulls the data from KHIS. So you can see it is plugged in, it is interoperable with the health information system. So it spares you the time that was manually used to download that data, and then the cleaning bit of the data also helps you with that. The other bit that AI does that the other tools that are existing are not there, and this is now the forecasting platform, is the application of seasonality, because it is able to look at data from many years back, and it is trained to detect trends. It tells you where there is any patterns of seasonality. So you are able to opt in if you would like your forecasts to factor in seasonality in the projections that you'll come up with. Then it gives you sort of a lower and upper bound for you to work with. So of course, AI won't be the silver bullet to be spot on. You definitely would need contextual information. You will need, like I mentioned, the domain expertise, the people who've been doing this and understand the program for a long time to give you contextual issues and to guide on now, out of, let's say, these three options, what is the most suitable forecast to go with, considering all those contextual issues. For example, there are plans to scale up a particular method or to downscale a different method, or there are trends in shift from one method to another. So those are also important factors that usually are brought into the table whenever these decisions are made. So those opportunities, just to reiterate, on data extraction, on cleaning, on the seasonality, and the efficiency, the time it takes to prepare the data ready to generate the forecasts, are excellent opportunities that we think AI, we not just think, but have seen and have taken advantage of, are coming to help us with in our forecasting. Back to you. Thank you.
Right, thank you so much, Dr. Johnson, for that response. I think that was the last question we had, and I'd like to appreciate you once again, the entire panel, Dr. Sylvia, Johnson, and Stephen, for moderating the session. I think at this point, I'd like to welcome our conference chair, Dr. Anmasi, to just give some remarks, and then we get into the announcements.
Thank you, Dr. Munyakin, and thank you to the panelists and all of you for joining us this evening, a holiday notwithstanding. I must really start by congratulating the winners of the Kahoot. I have tried many times and failed. It seems my fingers are not fast enough. So congratulations again. And I really hope that you enjoyed the session, even as we build up to the conference. And really, the sole purpose of this year's conference is to enrich the members, to improve that which you know, and to also introduce you to that which you do not know. And further, to provide you with a network that you can reach out to for guidance through those who have gone in the particular spaces and areas of specialization. So in this spirit, maybe we can move to the next slide, Dr. Munyakin. And in this spirit, we have really tried to curate multiple networking sessions just beyond the learning in the panels, so that we can encourage more in-depth interactions with the subject matter experts. So please feel free to join us from Tuesday, where we'll be meeting and greeting just before the conference, in the evening of the conference, and we'll kick off the conference on Wednesday. And in the evening after this, the busy sessions, we are going to have a paint and sip session, during which you can relax and talk to some of these subject matter experts who we'll have at the conference. And on Thursday, we are going to have a table networking session that will be quite exciting. And we'll be sharing more on each of these networking opportunities with you. Even as we build up to the conference and we encourage these discussions, I must say that to start us off at the conference, we will be, Mr. Osewe will be joining us to moderate a discussion around AI and the digital transformation. So please also today's panelists at the conference, and beyond the conference, they will still be available to guide you through areas of AI and areas of health policy. So thank you very much again for joining us this evening, and we look forward to seeing you in Mombasa. And back to you, Dr. Munyakin. Thank you.
All right, thank you so much, Dr. Anmasi. And I think for members, I hope you'll be joining us for this conference. Remember, we have a few days remaining, and through this period, you'll be seeing some of the sessions that will be happening that are going to be exciting. And lastly, I think I'd like to just mention about the on-site ticket that will be running up to the 18th of June. So if you've not booked your conference ticket, ensure that you do so on time so that you'll be able to attend. I think this marks the end of the session. Once again, I'd like to appreciate the entire panel, Dr. Johnson, Dr. Sylvia, and also Stephen. Thank you so much. For those who are interested in reaching to Stephen, he'll be attending the conference, so you'll be able to get in touch with him, and also we'll be able to share the contact with you. So at this point, I'd like to close the session and appreciate you so much for joining this, and we look forward to having you in the next events. Have a good evening, and thank you.